dimensions we have on hand already. In this tweet, you clearly indicate that vaccines alone will not be enough to combat COVID-19. However, as the CDC director in July of 2021, you coined what I believe to be a divisive slogan, the pandemic of the unvaccinated, suggesting that unvaccinated are the reason the pandemic persists, and to some extent pitting the vaccinated against the unvaccinated, which I don't think did any favors. This appears to directly contradict your 2020 tweet. What caused you to reverse your opinion?
I wouldn't call it a reversal of opinion. All of our guidance has demonstrated that we have layered mitigation strategies. We have all of the things that I comment on in the tweet. What I meant by the pandemic of the unvaccinated is that the people who were dying were largely the unvaccinated, and the whole point was to say, if you want to prevent severe disease and death, you should get vaccinated. You can do all of these other things, and all of them help. There was all this layered mitigation that we were promoting at the time. So I would say that that tweet and my actions as CDC director and that comment were actually all internally consistent.
Did the White House or any other official in the Biden administration pressure you or suggest to you that you should make statements that painted the vaccine as the primary solution for the pandemic?
No, but it was very clear from our vaccine effectiveness data that it was going to be one of the major things that helped us get out of it. I mean, we were seeing that as the CDC in all of our vaccine effectiveness data.
But I think you said earlier, that early on the vaccine was very effective, but later on it wasn't as effective, and people that were unvaccinated or people that were vaccinated were being hospitalized and were dying because the vaccine was no longer as effective as it was initially. Is that what you said?
I don't think I said it exactly that way. I think that over time we saw vaccine effectiveness wane, and over time we saw less effectiveness with the Omicron variants and their subvariants, but still to this day we see remarkable effectiveness at preventing ICU stays and preventing death if you've been vaccinated and boosted with the most up-to-date booster.
Honestly, I don't disagree with your initial statement, the tweet that was sent out. What I disagree with is the later statement that, that only the unvaccinated, are dying from this. At the time, this was a year into it. This was July of 2021 when you made this statement about the pandemic of the unvaccinated. We knew at that point that to be true what you stated earlier, that the vaccine was not as effective as it was before, and even if that applied initially, it no longer applied at that point, that far in. So what I'd like to know is, did political pressure ever impact your CDC guidance on your public statements about COVID-19? Did you ever feel like you were making statements based on political pressure rather than the science that was available?
I run a science-based agency. I'm a scientist, and the statements that I made are defended by the science.
And do you believe that any of the statements or the seemingly contradictory statements that were out there, do you think that contributed to the lack of trust in our public health system that we have today?
I would dispute the word contradictory. What happened over time is that vaccine effectiveness waned, and we got a new subvariant and variant that behaved differently in terms of how our vaccines worked. So it evolved over time. Our science changed over time. We learned more over time, and we had a new variant over time. And with that, it is my responsibility as the CDC director to update the American people with the newest science.
Well, Director Walensky, I think that there was a lot of things that went wrong during the pandemic, but I hope that that you're going to reflect back on your decisions as well and the statements that you made in the course of this pandemic as the CDC director, because I think they drastically altered how the American public views our public health officials. I think it's safe to say that your resignation later this month is going to be an important step in returning America's trust to an organization that you did great damage to, in my opinion, during your tenure. With that, I yield back, Mr. Chair.
I now recognize Ms. Dingell from Michigan for questions.
Thank you, Mr. Chairman. Dr. Walensky, thank you for your service, and I hope in this committee we can keep from those kind of personal attacks. Thank you for being here today and for the work that you've done to see America through the darkest days of COVID-19. We've heard a lot of misleading statements and accusations here today, and I want to set the record straight. Quite frankly, I'm tired of having the same conversations and hearing the same accusations over and over and over again. So let's clear this up. Again, there was no special access or collusion between the teachers union and the CDC to keep schools closed. And my colleagues on the other side are grossly mischaracterizing the situation. So let's go after the facts again. It is routine practice, and I believe common sense, for the CDC or any group, I do it, to consult impacted groups on guidance that affects them. Dr. Valensky, can you tell us more about why it's important for the CDC to engage with stakeholders on guidance that impacts them?
It was critically important to get the schools open, and in order to do so, we needed to make sure that the day that we released our guidance, it would be implementable on the ground. So we spoke to all the numerous stakeholders, over 50, to make sure that our guidance would be implementable on the ground. It would have been irresponsible not to.
So I also understand that when developing guidance to reopen all schools and help all schools stay open, the CDC engaged a wide range of organizations with various expertise. In fact, last week, HHS provided the Select Committee with a list of the organizations CDC engaged with in its developing the school reopening guidance. And it includes organizations like the American Academy of Pediatrics, the National Governors Association, they're more Republicans there than Dems, for the record, the American College Health Association, the Association of Public Health Laboratories, Autism Speaks, and the National Parent-Teacher Association, just to name a few. More than 50, and they're part of the record. Each of these organizations brought their perspective and expertise to conversations on how we get our schools safely and responsibly opened. And each of these organizations provided reasonable feedback to CDC guidance, like accommodating immunocompromised teachers when returning to in-person learning, or suggesting that if the new variant were to emerge and cause high community transmission, the guidelines would need to be revisited to keep schools open, not close them. These organizations recognized that the CDC shared their goals to safely reopen the schools. So while my colleagues on the other side so carelessly throw around outrageous accusations about collusion between teacher unions and CDC, I want to make it clear that the routine, practical way that CDC went about developing school reopening policies was common sense. I want to make sure we're giving the American people the full picture, that at a time the American death toll from COVID-19 had just surpassed 400,000, and that the first vaccines had only just been authorized for emergency use a few weeks prior to this guidance, and that only 46% of U.S. schools had reopened for full-time in-person learning when you came on board. I want us to be clear that CDC's guidance helped get kids safely back in the classroom. Along with the American Rescue Plan vaccine program, we were able to get more than 95% of schools reopened for full-time in-person learning 1 year later. Now, let's set the record straight on vaccines. We know vaccines are the safest and most effective public health measure that reduces hospitalizations and protects against severe disease or death from COVID-19. According to a Commonwealth Fund study published in December 2022, COVID-19 vaccines had already prevented 3.2 million deaths and 18.5 million additional hospitalizations. However, in early 2021, our nation didn't have the infrastructure to swiftly administer vaccines. Director Valensky, can you tell us more about the CDC's efforts to support a safe and equitable vaccine distribution?
Yes, thank you for that. We, as you know, did not have a vaccine infrastructure for vaccines for adults. It is something that we are asking for Congress to establish that, so we don't have to recreate one again. What I will say is that we worked tirelessly with our federal retail pharmacy partners, with federal qualified healthcare centers, with community and faith-based organizations, with our state and local health departments, across the country, with all sorts of partners, so that we could get vaccines. And we needed to bring vaccines where they were. We did mass vaccination sites, we did small vaccination sites, we did vans. It was really an all-intensive effort, but we need that infrastructure. That was stood up for COVID, and it is no longer, we will continue what we can for COVID with the resources that we have, but we do not have a large-scale vaccine infrastructure for adults.
Thank you. At this point, I want to also talk to my Republican friends about there's probably nobody with more vaccine hesitancy in this committee than me. I got Guillain-Barré from a flu shot in my 20s. And does that mean nobody should ever have a flu shot again? I was scared to death to get this COVID-19 vaccine. I think I even shared it with you at the time. I didn't trust doctors around here, to be perfectly frank. I went to the University of Michigan and talked to the infectious disease doctors, and they encouraged me that this was the right thing to do. It was a different chemistry. But I remain seriously concerned about Americans getting the wrong information, from misinformation about the disease and how it spreads, vaccines, and even treatments. Quite frankly, I have a very close, I won't tell you who the family member is because I might not be here if I did, but he supports President Trump. He took hydrochloroquine and almost died, was in the hospital for weeks, and they believe what they hear. So we need to make sure, and we know sometimes people are giving information that's the best information that they have at the time. But unfortunately, the world is experiencing the largest global decline in decades in the number of children receiving basic immunizations. And we are seeing a resurgence in previously controlled diseases like polio and measles. Dr. Walensky, how is vaccine misinformation affecting children's health?
I think that you nailed it spot on. We, for the first time last year, saw our first paralytic polio case in this country in about 10 years. We have seen numerous outbreaks of measles. In my inbox, I, not infrequently will get an email saying there's a new measles case that has been detected in the United States. It is critically important. We have seen a downturn in our number of incoming kindergartners who are vaccinated for all the ACIP recommended vaccines, and it is critically important that we maintain full vaccination for the health and safety of our children.
Thank you. Is there anything you want to add as I close?
Thank you for your support. I will say that it is critically important to get COVID-19 vaccine today and, for the fall, whatever we may see in the fall, also the flu vaccine for those who can tolerate it. But vaccines have been a public health staple that have been critically important for decades. We are actually, I think, are victims of our own successes. We are so blessed that we are not seeing these illnesses in our children because we have had vaccines for so many decades. Once we start seeing those resurgence, that's going to be really detrimental to our children.
Thank you for your service, and I yield back.
Thank you.
I would now like to yield to Ranking Member Ruiz for a closing statement, if he would like one, and he has asked that he could ask one more question.
Yeah, first I'll start with a question because I think this is very important. It's been said before, and you were brilliantly answering the question, and I want to give you more time to pursue the question of the difference between medical opinion and misinformation, because there's a debate as to when does a person's personal opinion become misinformation, and when does it become disinformation, which is the intentional misinformation. So can you elaborate more on medical opinion versus misinformation? And you were saying about with increasing science, the general, with accurate science, it becomes fact. And when does it become just a fringe opinion?
Yeah, thank you for that. So, I am not an expert in mis and disinformation. What I can tell you is early on in scientific knowledge and scientific query, we see, things emerging in the literature, groundbreaking work that appears in high-level journals. Those get corroborated over time. Those are widely accepted eventually as dogma in science. And then there are new questions that are presented based on that dogma. Certainly, we have done a lot of lessons learning in COVID-19. We had a new virus. But over time, there were widely, very well-respected experts in public health and healthcare and academia and scientists who really understood as the science was evolving and emerging. That, I think, we then take as fact. When you have people who are not trained in scientific in reading the literature, people are expressing their opinions who haven't read the literature, I think then you have to start to question upon which they are making those decisions and giving that advice.
I think that opinion versus misinformation plays in here because somebody's opinion can say that masks don't work. However, there's data and scientific fact that masks prevent the transmission of droplets from being transported in the air and infecting others. And you mentioned some scientific fact that that the incidence of infections decrease in settings where people actually wear their masks. So when does it become opinion versus misinformation? And then if people are well versed in the science or they read the literature and still proclaim that masks don't work, then does that become disinformation? The other thing to discuss is whether or not vaccines work. So now the science and public health research demonstrates overwhelmingly that when you vaccinate a population with COVID-19, you significantly reduce the transmission, you significantly reduce hospitalizations and deaths from the vaccine. We have real life experience in that we are at a different place than we were before the vaccines, and we also have scientific literature. So knowing in the aggregate that vaccines are safe and that they work, also knowing that our system of reporting adverse events, our system of learning about these and who are at risk of these adverse effects, and then recommending contraindications or recommending people not get the vaccine and using other measures is a system that works. But focusing on these adverse effects, when does it be, and to say that the statement vaccines are safe and effective is erroneous and dangerous, when does that be, is that opinion versus misinformation, not based on the aggregate of public health scientific fact, and if it's done intentionally, knowing and believing the medical literature, when does it become disinformation, intentionally moving it forward? And that's, I think, a big point that we're trying to say, because science is to help us get to the truth. And even some studies, you look at whether it was done correctly, whether it was methodology was flawed, and then you look at the rare study that has a breakthrough that leads us to a different path, and then we unfold and we pursue that path, and we unfold even more truths that will change our practice in medicine or in public health. And so, to capitalize on the confusion, or not the confusion, the complexity of science, to then say this is confusing and that's why it's wrong, or that's why it was intentionally misled or intentionally suppressed or intentionally covered up, is not necessarily accurate. And so in closing, I just want to really highlight the clear differences that we witnessed today. First, I want to really commend you, Dr. Walensky. I can yield if you want to say a few words.
Can we do that?
Yes, sir.
And then
I'll yield.
You don't mind? No, because I need to do the gavel.
Okay, look, he's got to go, so out of courtesy to the chairman, there's a clear difference today. I'm hoping that we can get out of being stuck in the quicksand of partisan narratives. I really do. We're like my colleague Debbie Dingle mentioned, we're talking about the same things. Whether there was politicization in the guidance, whether there was collusion, whether there was suppression, whether there was all these different things that, quite frankly, should not be a priority because they don't lead to the biggest impact that we can make in terms of systematic change to prevent the next pandemic. And you saw that the questions that we had were very focused on solutions, on the future, systematic changes that put people over politics in order to save lives. I yield back.
Yeah, and I apologize that I have to leave. I mentioned to you before the dilemma. Look, there's a lot we learned. We learned from the trials. We know that viruses produce variants. We know that the vaccine helped save hundreds of thousands of lives. I was totally for emergency use authorization. But we have the responsibility of looking forward. When we say safe and effective, it's like any other medicine. When you talk to your patients, you have to say, here's what we don't know yet. And down the road, maybe we will see side effects. But here's what we know at this time. And here's what we have seen as side effects. I think that's a responsibility that we have as physicians and in medicine in general in America. You know, I spent time trying to explain to people what 95% efficacy meant, right? And you took the time. And when it came to masks early on, when we had supply chain shortage, I said, if you only have one mask between the two of you, give it to the person who has COVID. They need it more than you to prevent the spread, in my opinion, right? So, you know, we've got things to deal with on infrastructure, supply chain, all of these to make the CDC more effective, but we've got to rely on data. And I'm just going to say, going for it, I want to get more accuracy to the system and accuracy to the doctor that you know, so that you can go talk to your doctor and say, what's best for me at this time, whether it's this or anything else. And we're going to continue to work on that. And I expect that we may be engaging with you a little further down the road. And with that, I yield back. And with that and without objection, all members will have 5 legislative days within which to submit materials and to submit additional written questions for the witnesses, which will be forwarded to the witnesses for your response. If there's no further business, without objection, the Select Subcommittee stands adjourned.